Wonderful. Well, thank you again to the organizers for having us and to the first two speakers for such an exciting and thought-provoking opening. My name is Sam Scarpino. I'm the Director of Artificial Intelligence and Life Sciences in the Institute for Experiential AI at Northeastern University. I'm also on the faculty in Health and Computer Sciences. I've spent the last 15 years working across sectors: real estate, energy, clinical medicine, public health, building decision support tools that try to translate data into improved decision-making practices. During the pandemic, I co-founded a technology cooperative called Global.Health that works with the kinds of semi-structured or unstructured data that occur very early on during a public health emergency, in part because we're often having the public health emergency because our data systems failed, right? Often the data systems are among our first lines of defense for identifying public health threats and then taking targeted action to prevent them from growing, in the case of an infectious disease, from a small regional outbreak into an epidemic or a pandemic. This organization now manages 150 million individual level COVID records from around the globe and is used by the WHO, the US CDC, for data management and public health emergency response. I also spent 2 years during the pandemic as a vice president at the Rockefeller Foundation, leading a multifunctional technology team, again, building products to improve public health decision-making all the way down to the individual level. So I say all this because we've spent quite a bit of time today talking about the practices with respect to data literacy at the citizen level, which of course matters during an emergency, at the business level, which again matters during an emergency. But we often get the best opportunity to identify challenges and opportunities in the face of incredible stress. And that's of course what happened in 2020 with the COVID-19 pandemic, is that basically all of our data literacy challenges and successes were put on the front page of newspapers around the globe. And so I've invited two panelists to join me who bring complementary expertise to this challenge of communicating and managing data and working on data literacy during emergencies. So Dr. Sanjay Mishra is a research associate at Brown University, and during the pandemic was the coordinator of the COVID-19 Cancer Consortium at Vanderbilt. And Michael Workman is the creative director at the AI Literacy Institute at Northeastern, AI Literacy Lab at Northeastern University. And prior to that, spent 6 years at the Boston Globe doing digital data visualization, interactive data visualization, and has a long, successful career in journalism at this interface of sort of data communication. So what I'd like to do is just have the panelists correct any mistakes I made on their bios, and maybe just say a couple of sentences about, sort of your high-level takeaway from the pandemic in particular around challenges and opportunities in the data literacy space.
Sure, so I can go first. Let's see. Everybody hear me? Yeah. So thank you, Sam. Appreciate that. As I was thinking about the COVID emergency and data literacy and data visualization, I thought a lot about the dashboards that we had on every place around us. On news sites, Northeastern had a dashboard, and I thought about how that was really a singular moment in terms of people engaging with data visualization on a really broad level. And so I found that really interesting to think about how every one of us was looking at a dashboard every day. And some of us do that for our jobs on a regular basis, but there were so many more people who were doing that. So I think like that process of bringing that data to people and really making it useful for them is really kind of what I was always focused on when I'm working in journalism, was how do we take something that's a complicated subject and bring it to people and really bring them what they need and kind of respect their attention and their time, because we are in this such a crowded media environment. Our attention is so fractured. So I think that was a moment where data literacy, data visualization really came to the fore in a really interesting way. So.
Thanks for that introduction. And I do have a little correction. While I am a scientist in the day, in the night, I'm very proud of my science writings that I've been doing it for the last 3 years for National Geographic predominantly, and also for PBS and others. And I think in that role, I struggle at both levels. As you mentioned, that we put together this consortium of COVID-19 and cancer. And along with that, I was also a vaccinologist before switching to that role. So I was well aware of what the vaccines can do and cannot do. And yet, as a science writer, I struggle with how to communicate things that are too astute and also to a very skeptic population. So Hamid was talking about the data citizens, and I think that before we reach to the data citizenship, I think we also have to somehow build a movement towards the data curious and data skeptics. Because there is both end of the problem. We have a lot of data which is not always correct. It could be spurious, and correlations are not causations. So oftentimes on my writing side, the struggle that I had the most was the people who had a very cogent sounding argument because they had seen a data. But what was very difficult to explain to them that all anecdotes are not data and plural of anecdotes is not data, as someone said. So I think that is where me as the part educator, part scientist, and part communicator struggles as to how do we build a society which is at both ends can digest the data and yet do not misinterpret data, because both ends can be extremely dangerous.
Great. I think this is on. Thank you both very much. So for the next question, one of the things that Michael and I were talking about at dinner last night is that the ability to communicate data is not just about the statistics and the numbers, but it's about how you tell the story. And there's a quote from Professor Peter Dodds at the University of Vermont where Peter says that you should never bring statistics to a story fight. And that one of the ways that scientists, science communicators, et cetera, often fail on the data literacy side is in winning, the hearts and minds of citizens, of business leaders, of politicians, other decision makers, because they fail to tell the story behind the data, and they often, to your point, they rely on numbers and statistics in an effort to convey a sense of confidence, which often doesn't have the desired effect. So I'm just curious, from both of your perspectives, sort of what you saw during the pandemic that were good examples of sort of data storytelling and how that interacted with literacy, and maybe where there are some opportunities for us going forward.
Yeah, I mean, I think broadly, again, it goes back to editing and to thinking about people's limited attention spans and thinking, what are the ways that we can tell the most important parts of this story. So we're not going to be able to tell everything. So really thinking about boiling that down into some, really simple things. And I think to some degree, the simpler that you make it, and again, without oversimplifying, the simpler that you make it, the easier it is for you to also explain what's behind that. So if you're looking at one specific area, it makes it easier for you to go deeper and, again, to provide some of the context that could potentially help people who have less background. So I think the more that you can focus, maybe focus is a better word, the more that you can focus on a particular aspect of what you're telling, I think is really going to help you with all of those pieces. Whereas if you set out to really try to touch on so many topics, I think that's when people start to the attention problem starts to become bigger when you're talking about the general public.
I think I absolutely agree. And I again, as a scientist and also with somebody who had adopted English as a second language, I have been extremely privileged to work with the editors who, by their own admission, don't understand science. So they were always my first reader, and oftentimes their questions would help me as a scientist to decipher what is really at the end important. Now, as a scientist, most scientists are used to, I mean, although there are collaborative sciences, but majority of scientists work pretty in unison. I mean, it's their work, they publish it, they write it. Data science is different in the sense that it is one of those branches where by design, you work with the statistician, you work with the analyst, and at the end of it, you work with somebody who writes it, and they may not be the same. Statisticians are not always the best people to write the stories. So I think we also have to evolve into that collaborative process into the overall communication structure, whether it is in the newspapers or whether in the science journals, to have that kind of a skill develop, because I don't think at this point most curriculums in sciences at least, have any component of storytelling of the science and the data itself. Now visualization, people who work with visualization, they work a phenomenal job because a dashboard makes seeing is believing, but not every data can be shown in that concrete way. And when you're writing, you get bogged down into the jargons and the numbers. And it is something as a scientist, you are trained to stick to it. And you believe that that is what is the final truth. But as you said, that doesn't do a very good job of communicating. So I think we have to have a societal dialogue at the communication level and at the training level. How do we train people to digest data and then also explain it to others?
And Sam, if I can take the moderator hat back from you.
Go ahead.
And say, and because I was interested in our conversation last night about, I think people would be really interested to hear about your experience talking to the media during COVID and like what you kind of learned out of that and some of the things we were talking about last night.
Yeah, great. I was actually going to mention a couple of those as the next, so I'm ready. The first thing I would say is so one of the fields that I work in is around infectious disease forecasting. So trying to estimate how many cases of, COVID there are going to be a week from now. And in some ways, it's actually not that hard to do. So if I want to estimate how many COVID cases there are going to be tomorrow, it's pretty hard to just beat guessing the same number as today. For the most part, it doesn't change that fast. Now, up 3, 4, 5, 6 weeks from now is a completely different story. One of the biggest frustrations in this space was that the model that was most consumed by the media and most on display for the public was also the model that was demonstrated to be the most problematic in terms of its accuracy in the scientific literature. And this was a new group that came, this is a very well-established group, but it was a new group in the forecasting scene during the pandemic. And so it was incredibly frustrating for a lot of researchers in this space. They either had someone on the team that really understands how journalism works, or they got lucky. And what I mean by this is that not only did they have real-time forecasts at the county level, and part of the reason their models weren't very good is that we didn't really have the right kinds of data to be doing that in the first place, but they just did it. The more important reason is all of their data were fully downloadable in a spreadsheet format. And the reason that this matters is if you've ever worked with a television station, print media, basically anyone that's going to publish anything, if you send them data, they will put it in their own style guide. And if they can't do that, they won't run it. And so if you have a publication or if you have a website with forecasts on it and you can't access those data very quickly in a format that is open such that they can rebrand it in their own style guide, obviously with attribution, it won't run. And as far as I am aware, this was the only model in town that was providing that kind of information. So I'd say kind of the first thing that I learned is that it's either important to be lucky or it's important to know a lot about your desired consumer, which in this case was not necessarily the public. It was the print journalists. It was the online data editors. It was the television stations, et cetera. I think the second, and this is one of the things that we were talking about, a lot of the relationships that I had built before the pandemic on the journalism side kind of carried me into the pandemic very early on, when all of us had to figure out how to work together with respect to communicating this information. And so the investments that organizations that I'd worked for in the past, like the Santa Fe Institute, had made to bring data communicators, science journalists, et cetera, with scientists together under the same roof, those really kind of sustained me very early on during the pandemic. And so a little bit of investment outside of Emergencies in training individuals in data literacy, how to work with the media, what is likely to be useful or less useful, will pay off immensely when you're in an emergency situation. So I think maybe the way that I would put it is we want to invest now so that we're not kind of scrambling later. Maybe the last piece I would say is sort of the proudest moment, and again, this is to Hamit's example during in sort of trying to quantify and qualify what we mean by data literacy. At the Rockefeller Foundation, we were trying to inspire better data reporting practices. And for example, during Omicron, one of the things that we wanted to know a lot more about were these breakthrough infections, where the vaccines were failing and where they weren't failing. And states weren't reporting on, in the US, on these breakthrough infections. And they weren't not reporting on them because they were trying to hide something. They just, most of them didn't really have procedures in place for capturing that information in the right way and reporting it to the public. So we developed a scorecard that benchmarked people's data reporting practices in different states. And states actually use this to improve their own reporting practices, right? So oftentimes you think of a scorecard as something that may be kind of shaming. I'm coming to the proud moment because it actually does involve shaming. But often if you give an organization a bar, they will try to rise to it, right? If you tell them this is where you need to be, they will try to get there. And I think that's one of the important things that hopefully will come out today. So the story is, state of Nevada ended up with a D-, I think, on the scorecard. And the governor was being interviewed on CNN, I think about Harry Reid passing away. And at the end of the interview, the governor said, the interviewer said, I have one other question, which is I saw a report from the Rockefeller Foundation that you received a D- on your data reporting. Care to explain? And he sort of fumbled around a bit, and then we got a phone call from one of his chief public health officers wanting to know how they could improve their grade. And this, of course, only happened because we had a good relationship with the anchor and we'd slipped them the report ahead of time. And so building these kinds of trusted relationships, they go both ways, right? If you have these trusted, regular relationships with your journalist colleagues, you can leverage those to try to improve reporting practices. I'm going to take a couple of questions from the audience in the last few minutes, and hopefully we can focus on Michael and Sanjay for the questions. So, yeah.
Thank you. So flatten the curve was really, for me, a really powerful argument for guiding my action. It was great. Thank you. I think but there was a different challenge of not having enough information when it came to staying home, right? We knew from a policy perspective that it was good to stay home to cut down transmission. At the same time, staying home was consequential in different ways. And communicating that conflict in a way, that trade-off. Can you talk about the strategies for communicating that and what worked and maybe what didn't work? It's a different kind of narrative to me. I don't know if it's a good question or not. Thank you.
Your question is wonderful. The problem with communicating anything is that you are only trying to explain what you explain. So I actually never quite wrote or made any opinion on staying at home because I knew right from the beginning, while it is a noble thought, economically it was extremely burdensome because I come from a very poor country where I know that some of my people would have to go earn their daily wages every day. So I knew that was a privilege, and I was afforded that privilege. For the last 3 years, I have been working mostly from home. Maybe one of the reasons why I was late this morning is because I've lost the habit of commuting. But the masking was definitely the part where I have written extensively, and I tried to make the case. The problem is that you communicate to people who interpret whatever you write or whatever they see based upon whatever lenses they wear. So I moved in the New England from somewhere deep south of United States just recently. The entire conversation around COVID seems like we live in two different worlds. Just a couple of days back, there was this old couple at the CVS who was waiting for their latest booster. And I joked at them that, sorry, I made you to wait for long. And they said, well, it's worth waiting for saving the life. And I said, down south, nobody would wait for a second to save a life. So I think that's where the problem is. And so whatever you do, it is going to be written by a person of their own volition, and then is going to be read by someone else with their own contorted worldview. And I don't think we can never have a good balance. I think what is more important is, and I think this is where the credit goes to the media, we have, over the last 3 years, I have lost a lot of wonderful editors. And one reason is because nobody wants to pay for media where something good can be written. And when it is written, it is unfortunately behind paywalls, so most people either don't have time or money to actually read anything. So I suppose we have to have a dialogue more on that than the interpretation and communication.
Great. Well, I think, unfortunately, we're going to have to close and have some conversations afterwards. I will just make one brief point, which I think, in contrast to that, one of the questions that I was asked, I spent a lot of time saying yes to Boston Sports Radio to be interviewed about the pandemic. And one of the questions they asked me was, explain why it is that we can't have Thanksgiving at home with our families, but bars and restaurants are open. And I said, well, they're incompatible. Either they're both safe or they're both not safe. And so I think oftentimes one of the challenges during the pandemic is that the public was aware that the policies were not compatible with each other, right? And so that incompatibility leads people to sort of question everything, which is why are we doing any of these things that are miserable and have economic and educational effects, et cetera, when the policies don't seem to be in line with each other. So maybe the thing I would say in closing is that I think the public is not as unaware of things as we often feel that they might be, especially when they're highly engaged in something. So again, I want to thank Sanjay and Michael for joining the panel, all of you for your attention, and looking forward to continuing the conversation.